We'd like to offer a simple proposal that would reopen the government and extend the ACA premium tax credits simultaneously.
Democrats on Capitol Hill intend to hold the government hostage in order to extend COVID-era ACA subsidies that they themselves intended to expire. Not only are these temporary government subsidies standing in the way of hungry families getting food they need and workers from getting well-deserved paychecks, but it's also not making the healthcare industry in this country any more affordable. COVID-era Affordable Care Act subsidies are linked to lower claim approval and increased insurer profits through the idea of zero-claim enrollees. This is where a large number of heavily subsidized individuals do not file claims and allow the companies to retain the full amount of the subsidized money. I quote, "Data shows a significant increase in the number of ACA enrollees who do not file any medical claims during the year, more than tripling from 2021 to 2024. In 2024, an estimated 35% of all enrollees, nearly 12 million people, had zero claims, including 40% of those in fully subsidized plans." End quote. The surge of these zero-claim enrollees, some argue, is evidence of phantom enrollment and increasing fraud, where many of these individuals are not even aware they are enrolled in these insurance plans. Let's break this down further. Number one, the COVID-era ACA subsidies, originally designed to make health insurance more affordable during the COVID-19 pandemic during a health emergency, is actually resulting in increased profit intakes by these private insurers on unclaimed premiums. Number two, it's estimated that billions of taxpayer dollars yearly are going to these insurance companies and not actually making any meaningful impact. This is because zero-claim enrollees are not adequately accounted for. Number three, since the COVID-era ACA subsidies were passed, the health insurer stock prices have significantly increased. Number four, with guaranteed money from the federal government, these insurance companies are motivated to accept enrollees, but are not motivated to provide the best services. In a system with adequate competition, insurance companies are motivated to match the price of the competitors or lower them. However, with these guaranteed COVID-era increased subsidies, these insurance companies are seeing massive amounts of guaranteed taxpayer money on a yearly basis enter their profit margins. In conclusion, the COVID-era ACA subsidies are meant to be temporary. Not only would extending or making them permanent not solve the issue of health care affordability, but it rewards insurance companies for providing lesser services than they would otherwise provide. Indeed, the ACA itself, when excluding the COVID-era subsidy expansion, provides protections that are valuable to lower-income households. But these protections would thankfully remain in place if we let the COVID-era subsidy expansions expire. Let me say that again. If we let these COVID-era government handouts to these private insurance companies expire, the ACA core protections remain. I think we all can agree that insurance prices are way too high and insurance in this country needs to be made a lot more affordable. With that said, there are ways to do that, like lowering drug costs, increasing efficiency and operational practices, increased government accountability against monopolies in this industry, and outlawing predatory practices and stuff like that. What's not helping is giving these rich insurance companies guaranteed income in the trillions and expecting them to retain the same coverage, the same product quality that they would otherwise give.